Care and Caregiving. Dr. Keith Anderson is an associate professor in the College of Social Work at The Ohio State University. His teaching interests are social welfare policy, geriatric social work, death, dying, and bereavement. His research interests are quality of life and long-term care facilities, family and professional caregiving, civic engagement for older adults, and end-of-life issues. His recent work with Allison Gibson is titled Difficult Diagnosis: Family Caregivers' Experiences During and Following the Diagnostic Process for Dementia, and was published in April's issue of the American Journal of the Alzheimer's Disease and Other Dementias. Please join me in welcoming Dr. Keith Anderson.
Everybody for coming out on this rainy day. As Katie said, I'm a professor in the College of Social Work up at Ohio State. My past experience, I was a social worker in a nursing home, and then I went back and did my PhD in gerontology and continued to work in the social work field. It's springtime, so it reminds me of a kind of a funny story we had when I was working in the nursing home. Like I said, it was springtime, and baseball season is a big thing in the springtime. So I said, why don't we have like a little picnic, like a baseball picnic? We'll have peanuts and Cracker Jacks and hot dogs and beer and stuff like that, everything I associate with baseball. So they said, yeah, that's good, Keith, but we have to have non-alcoholic beer. And I said, well, that makes sense. So we did, and we're having the party. We're watching baseball on TV on the special care unit for dementia. And the people are drinking the non-alcoholic beer, and I'm getting comments like, I haven't had a beer in so long, this tastes so good, it reminds me of summertime. Well, about an hour later, we were finishing up lunch, and we had an activity in another area, and we were trying to help people move over to the other area. Some of the people said they couldn't stand up, they had drank too much beer, you had people stumbling around and belching and stuff. It was really it was a classic, so very funny. So it reminds me of springtime when I think of that. Let's see, today, and I think I have a clicker here. Well, I don't think this is working, but that's all right. Today we have an agenda, of course. We always have an agenda. We're going to be talking about a little bit, touching on traditional caregiving. What are the approaches, sort of the low-tech approach to caregiving? We'll be looking at technology in caregiving, things like e-care and i-care, electronic care and intelligent care. And then we're going to look beyond technology at some kind of emerging situations and alternatives that you may not have thought about caregiving. And then we're going to have some questions and maybe some answers. I don't know if there's ever any answers really. So, traditional systems in caregiving, as you probably are well aware, traditionally provided in the home. So, friends and families as caregivers, some of you are undoubtedly caregivers yourselves. And then we can look at auxiliary services that are also used in caregiving, so things like home health care, adult day health, which you're probably all familiar with, I would guess. Adult day health, maybe not. Home health care, I would assume. Home health care agencies are professionals that you would hire. They come into your home and provide you with services. So nurses, you could be social workers as well, PT, OT. Adult day health services are places where you can bring the care recipient usually during daytime hours, and they provide health care services, activities, interactions, meals, pretty comprehensive services. I just did a study on adult day health. It's one of the fastest growing areas in the long-term care spectrum. So something to think about if anyone is interested in adult day health. My contact information is listed there. And also the folks at the Alzheimer's Association are pretty well aware of Adult Day and what they can do for you. Long-term care, I think most of us know about long-term care, assisted living, and nursing home care. So that's sort of the extension of caregiving in the traditional systems. We can look at sort of the drawbacks of our current long-term care approach, and we could call it the low-tech approach. It's very labor-intensive. As caregivers, you know there is quite a bit of caregiver burden, both physically, emotionally, financially, socially. There's a projected shortage of family and formal caregivers. Our families are becoming smaller and smaller. We're having less children. There's fewer people to take care of us as we grow older. And there's also fewer people who are going into the nursing field and caregiving fields. There's a projected shortage with the baby boomers coming of age. So that's a problem to look at. And then it's expensive in a lot of cases. Nursing home costs are prohibitively expensive. The nursing home that I worked at, I think it was, maybe it was $12,000 or $15,000 a month to stay there, which was pretty expensive. So you can see how that you would eat through your retirement savings pretty quickly at a place like that. The low-tech approach is also ineffective in certain ways. Promoting health and safety. When we leave our care recipients at home, a lot of times we have no way to tell whether or not they're safe until we get back home. So that's problematic. Fostering independence. In a lot of cases, things like safety concerns will prompt someone to institutionalize a care recipient. I just can't leave that person at home all day long. I'm afraid something's going to happen. And then facilitating aging in place, allowing people to stay in their home. The low-tech approach is not really great at that. A lot of people, because of safety reasons, because of care needs, they aren't able to stay at home. They have to move to an institution. So we're thinking maybe some of these high-tech approaches might help us. So let's take a little look at that. E-care, they call that electronic care, and there's a couple different examples of this. Medical informatics, essentially that means information through technology. So examples could be online information and connections, things like online support groups. I don't know, does the Alzheimer's Association have online support groups, or here in Central Ohio?
Yes.
Yes. Okay, great, thank you, from the back of the room. So online support groups is a growing area. A lot of times you can't get to a support group because you are a caregiver. So online support groups are really a nice, effective approach. Computerized patient records. That's a big thing that's coming in the future, and it's already here in a lot of cases. I know at the VA, they kind of led the way in terms of computerizing their medical records. Oh, we need to go back to that first slide. They have these, I don't know if you've heard about these implantable chips that you can get implanted into you, and it'll have all your medical records on there. And they can, so if you go into an emergency room or a doctor's office, they can hold up a reader to that. It automatically reads your medical records. And you can update them without operations, all that. So probably into your forearm or something like that, into your shoulder. I'm not sure where else. Like maybe you could put it wherever you want. I don't know. You probably don't want to sit on your medical records. So it's interesting, it's convenient, it's also a little bit scary.
GPS?
Could it be a GPS? There are implantable GPS devices too, for monitoring people's whereabouts. Maybe good for teenagers, maybe. I don't know about that. Yeah. But you know, for wandering or something like that, it's something to think about. I don't know if it's practical. Next slide. E-care, which is electronic care, so telehealth and telemedicine. Maybe you're familiar with those terms. Essentially, it's health communication using technology. So examples could be remote patient monitoring. So someone could call in to their physician and talk to them about what they're experiencing, and then get advice from their physician. When they say tele, it's really moved over to computers, really. So you could have a two-way conversation with your doctor, or you could show your doctor a rash that you may have on your arm, and the doctor could look at that and make a diagnosis from there. Some of these remote examinations are really interesting. They've used them in prison settings. So rather than a doctor or nurse having to go into a prison and be exposed to possible harm, they can remotely examine some of the prisoners in terms of what their health is and what their problems might be. So kind of interesting. You hope that the technology that we use with our older adults isn't stuff that's adapted from prisons, but if it's useful, it's useful.